Welcome to this educational presentation on otitis media, a prevalent ear condition affecting individuals, especially children. Otitis media is defined as an inflammation of the middle ear, often associated with the accumulation of fluid behind the eardrum. This inflammation can manifest as acute or chronic. Several factors contribute to otitis media, including bacterial or viral infections, dysfunction of the eustachian tube, and environmental factors. Young children are particularly susceptible due to the underdeveloped nature of their eustachian tubes. Clinical manifestations of otitis media include ear pain, fluid drainage, hearing difficulties, and irritability. The signs may vary based on age, necessitating keen observation for accurate diagnosis. Diagnostic methods include otoscopy, tympanometry, and, in some cases, imaging studies. Precise diagnosis is crucial for tailoring appropriate treatment. Treatment options encompass antibiotic therapy for bacterial infections, pain management, and surgical interventions like tympanostomy tube insertion. Watchful waiting may be employed in certain situations. Nursing professionals play a pivotal role in the comprehensive care of otitis media patients. Their responsibilities include addressing the physical and emotional needs of both pediatric and adult patients. In antibiotic therapy, nursing professionals focus on patient education, medication administration, and monitoring for side effects to ensure adherence. Additionally, they play a crucial role in pain management, providing comfort and support during episodes of discomfort. For surgical interventions such as tympanostomy tube insertion, nurses are instrumental in preparing patients and providing postoperative care. Pediatric considerations in nursing care involve effective communication and engagement with young patients. Preventive measures, including good hygiene practices and timely medical intervention, are highlighted. Nursing professionals contribute significantly to patient education, empowering individuals and families with knowledge. Real-life case studies illustrate effective nursing management strategies, addressing challenges and showcasing successful outcomes in otitis media care. Looking ahead, ongoing research and potential advancements in otitis media care are briefly discussed, emphasizing the importance of nursing professionals staying informed and contributing to evidence-based practice. In conclusion, nursing students are encouraged to approach otitis media care with compassion, attentiveness, and a commitment to ongoing learning. The presentation concludes with an invitation for questions and discussions from nursing students to deepen their understanding of nursing management and otitis media.